This video is designed to provide some guidance as to options for pain relief in the treatment of fibromyalgia. The following link provides an excellent way to spend an hour reviewing options where Dr. Andrew Gross at UCSF addresses the pros and cons of the medical and prescription options that are available to you. If you're looking for options that are medical prescription options for widespread pain, Dr. Gross addresses the efficacy and some of the difficulties in long-term use surrounding the different options that are available, including Lyrica, Zymbalta, and other prescription options. More recently, IV lidocaine options and cannabis oil are touted as the best viable options. In my experience, I was warned against the IV lidocaine option by a medical doctor in the medical community. When I attended the clinic that specialized in the IV lidocaine options, it was noted that a 5-year history, the 5-year maximum of information and data was available. I was also warned against the newest touted medical cannabis oil alternatives that were available for the same reasons, i.e. no long-term studies were available, and there were also some indications regarding adverse side effects and some severe warnings. In this clinic, the medical specialist noted that a normal person has a pin-size pain center, but for fibromyalgia patients, this pain center is a pea-size when imaging is taken, which means that, in simple terms, an equivalent pain measure that a typical person would experience at a 5 might be experienced by a fibromyalgia patient at a 9 as part of the widespread pain. The following 3 options that follow were reasonable options that are relatively easy to find at health food stores and do not have adverse side effects, gastrointestinal or other, that are noted. Again, these should be used for a temporary period of time as the underlying sources of your fibromyalgia are explored and as an interim measure. You will find that as your symptoms do improve, albeit marginal, that your reliance on these pain relief items may decrease. The first option is created by Genuine Health, and Genuine Health has a couple of alternative products available. This is called Pain Relief Plus. Look for the version that says Pain Relief Plus, which contains bromelain, noted as an anti-inflammatory, among some other options that assist with stiffness. You'll note in here that white willow may come up again in some of the other products that you see. Devil's Claw, which may have been given to you by your doctor in the form of Droxinol, is another option that may come up. And of course, turmeric, that is touted in many different supplements as anti-inflammatory and beneficial. Another option is produced by Sisu number 7, and this is a combination of Boswellia extract, which is noted by Dr. Tita Baum, who is a medical doctor in the US that also has a publication of a paperback book regarding fibromyalgia. Collagen, which comes up quite a bit in the literature with respect to leaky gut and gastrointestinal issues and healing the lining. Vitamin C, which is an immune system supporter, and turmeric. Again, we see turmeric and white willow. This product is chock full of great options, including ginger and cayenne, which are also healing to the gastrointestinal lining and reduce the bloating and stomach upsets that you may experience. What you may wish to take in conjunction with the Sisu number 7 is a product by Platinum called Inflacarex, and this would be taken on an empty stomach. You could take 1 to 2 on an empty stomach, and you'll notice that this contains bromelain as well included in this combination product. You see again Devil's Claw and turmeric in this one, Boswellia, and Cat's Claw, which is noted as another anti-inflammatory. So you will see some overlap between the products, but those are 3 very good products that you could try independently. A fourth option, which might be beneficial for you if you have more joint-related stiffness, is a Nature Sunshine product, and this product contains Devil's Claw, So again, you'll see some of the overlap between bromelain and white willow, and yucca, which is used as a Mexican yam, which provides pain relief benefits as well. You'll see some other alkalizing types of herbs noted in here, such as celery and alfalfa. So this is a good combination product as well. Although I found with the emphasis particularly on pain that the first three products noted were among the best that I could find and most suitable. The next step immediately as you cope with your pain is to make some major modifications to diet. If you haven't already done so, you may need to make some significant dietary changes because food sensitivities may be exacerbated as a result of the taxing of your immune system. You might want to start some testing if you have any holistic practitioners available and have some gastrointestinal testing done and parasitology tests, which can be sent away and may be able to provide you some information on your IgA levels in your immune system. Exercise is very difficult initially, and as much as the common referral to add 1 minute a day to your exercise regime is kind of a general statement that's made, I would suggest that that's not appropriate for fibromyalgia sufferers. I think your goal should be if you can get to 10 minutes initially and keep that up for a month, then try to do that 6 days a week. Give yourself 7 days a week and try to push through, even if it is on those days where you feel particularly ill. I've been in this condition where 10 to 15 minutes was very difficult. Eventually, as you start to improve and these changes in your lifestyle habits and improved dietary changes occur, you will lengthen it and you'll get to 20 minutes. And that may be 4 months down the road, or it might be 2 months down the road. So give yourself some kindness and flexibility to do so. This is key. Eventually, after a year, I made it to 30 to 40 minutes. I don't pressure myself to go beyond 30 minutes, but that's my standard that I know I can push without slipping back. That's after a year. So the goal is to maintain a level of energy after your exercise as well. I would suggest starting first thing in the morning. And if you have a treadmill or stationary bike or a recumbent bike available, then try to use something in home so you don't have to go out and actually extend the energy to drive elsewhere to do your exercise, which may not even be an option as it wasn't for me. Reducing stress in any areas that you can identify them, get a journal, and you'll start to journal some of the things that cause you stress and some of the things that give you great pleasure and joy. You'll distinguish between the two, and you'll try to reduce and take off your plate some of the things that cause you stress where it's viable and reasonable. We can't always remove all of those things. I have teenagers. But you'll start to pay attention to some of the things that maybe are impacting your symptoms and exacerbating them at certain times. And then key for fibromyalgia sufferers, since we have IBS in common, is at the forefront, and there will be a video on this addressing some of the gastrointestinal issues. There are lots of sites available to address this, and Amy Myers has some wonderful information and newsletters that go out almost daily with a gastrointestinal focus. She has products as well, but there will also be a video that follows built on this.